The rapid spread of COVID-19, recognized as a pandemic by the World Health Organization, led the national government to declare a state of health emergency of March 12. For almost 100 days, public and private schools in the country suspended their activities, where mothers, fathers, and caregivers became supporters in the educational process of children and adolescents. According to a study conducted by the Colombian Institute of Neuroscience, 651 households with 1,044 children under 18 years of age, 88% of the children and adolescents in the surveyed household have signs of related to change in mental health and behavior. These behaviors mainly affect people between the ages of 4 and 12. Therefore, it is important to follow specific guidelines that help the mental health care of children.
At this time, the mental health of children is very important because they are people who have priority in their protection. It is important that we as adults can talk to them at this time about the restriction of circulation and mobility restriction to leave home.
The professionals say that it is important to talk to the children about what is happening in the world in a way that does not insist fear in them and that creates an attitude of protection and preservation of life. To do this, caregivers can support themselves through stories, songs, or tales.
We must also be aware that they have a routine in the house that is combined with the most common daily experience of the children. That is, to have a space for food, rest, games, to look at the advantages of being able to interact more with our families.
This study also showed that 42% of children have signs related to alteration in academic skills, 41% have problems going to bed or getting up, being more frequent in people over 13 years old. That is why following these guidelines mentioned above are of vital importance in children's mental health.